Polycystic ovary syndrome, PCOS, is an endocrinological disorder that affects around 10% of women of reproductive age. It is a condition characterized by hyperinsulinemia and hyperandrogenism. Clinical studies show that excess of these two endocrine drivers is positively correlated. Clinical symptoms of PCOS include hirsutism, acne, hair loss, polycystic ovaries, obesity, irregular menses, and infertility. In fact, over 70% of PCOS women have difficulty conceiving. Inositol deficiency is evident in PCOS women. The plasma inositol level of PCOS women was significantly lower than normal women. On the other hand, the urinary clearance of inositol of PCOS women was 5 times greater than healthy women. Inositol, an insulin sensitizer, plays a major role in the insulin signaling pathway. In this pathway, insulin binds to its receptor on a cell and forms the insulin receptor substrate IRS complex. The IRS activates phosphoinositide 3 kinase, PI3K, to induce the translocation of the GLUT4 channels that let glucose enter the cell. Inositol deficiency decreases PI3K activity. It impairs insulin action, leading to insulin resistance in PCOS women. Insulin resistance causes compensatory hyperinsulinemia, which eventually leads to hyperandrogenemia. Gynositol is a dietary supplement made in France. Myo-inositol and folic acid are the key ingredients of gynositol to compensate for the inositol deficit and prevent neural tube closure defects. Studies have shown that 4 grams of myo-inositol and 400 micrograms of folic acid daily is a formulation with proven clinical efficacy. 2 sachets of gynositol suffice as clinically proven dosage to reduce PCOS symptoms, gestational diabetes mellitus risk, and difficulty in conceiving for PCOS women. A randomized controlled trial showed that PCOS patients receiving the formulation experienced 84% increase in insulin sensitivity and 66% reduction in total testosterone compared with control group. An observational study showed that treatment with the formulation restored ovulation in 70% of PCOS women. 15% of infertile PCOS women successfully became pregnant in 3 months. In a meta-analysis, women with PCOS undergoing ovulation induction experienced significant improvement in both quality of the embryos and clinical pregnancy rate in the myo-inositol plus folic acid group compared with the control group. The benefit of the ingredient combination extends to pregnant women at risk of gestational diabetes mellitus. According to a meta-analysis, there is a 56% reduction of GDM in women administered myo-inositol plus folic acid compared with control group. The formulation showed efficacy in various cutaneous symptoms in PCOS patients such as acne and hirsutism. After taking the formulation for 6 months, half of the patients had disappearance of acne. The severity of hirsutism also significantly improved in subjects after 6 months of therapy with the formulation. Considering the wide range of benefits of the formulation shown in clinical trials, gynositol is well suited for PCOS patients and pregnant women. Inositol is the only dietary supplement recommended as an experimental therapy in PCOS in the International Evidence-Based Guideline for PCOS 2018. For more information, refer to the product page below. Gynositol, your trusted solution to unfulfilled desire for pregnancy.